namaste, guys. I am Dr. Anushruti and I am back with an amazing episode. Well, first of all, I would like to tell you all that today I have a very bad throat, and this is why you can hear this bold and a little bit of blurry voice. But we don't need to worry because today I have someone who I believe is going to take over the podcast and tell you a lot about today's episode. Well, today on board, I have Dr. Trevor Watson, who is a physical therapist and specializing in neurology. Well, neurology physical therapist, I believe, is new to my episode, new to my podcast. And when we have a special guest like him, why would we skip this chance to meet the ends of preventing and treating neurological injuries? Well, let's welcome him and discuss directly with him about all these conditions. Hello, Dr. Trevor. How are you?
I'm good. I'm good. Thank you for inviting me. I'm glad to hear that I'm the first person to discuss neurocare. That's exciting.
Thank you so much. Well, I really want to know what exactly is this branch of physical therapy? What exactly is physiotherapy in neurology? What does it holds?
So I guess in terms of like separating it from other therapies, we're focused a little bit more on anything dealing with the brain or spinal cord primarily. I would say we see a blend of brain injury, stroke, spinal cord injury, Parkinson's disease, multiple sclerosis. I actually treat a lot of limb loss at our clinic as well. So yeah, it's a good blend of kind of a little bit of everything involving the brain or spinal cord. Yeah, that's what separates it from other disciplines.
So,
I
do
mean, from
you
other
feel like we have a lot of specialities, pelvic floor specialist and then orthopedic, women health? So, do you feel that neurological physiotherapy can be or is a part of someone's day-to-day life activities as well? Like person who's not having any mental conditions or underlying problems mentally or neurologically, would that be also helpful for them?
in terms of like using tips they've learned from like their
Yeah,
oh
yeah.
absolutely it's crucial to be doing some form of your activities or exercise that you've learned in therapy daily. And we can talk about this later, but there's the 10 principles of neuroplasticity, which I talk to my patients about a lot. And one of them is that intensity matters and repetition matters. And so the more you do of something, the more you can develop those neuroplastic changes in your brain to help improve your function. So yeah, definitely a part of the day-to-day life for sure. Not just for the patients, but also for their family members as well. Because
Yeah.
depending on the severity of like how involved they are or how like the severity of their diagnosis, a lot of times we're educating the family members just as much as we are the patient.
So, apart from balance, posture, and some, mental conditions, neurological physical therapy can also be helpful in attaining mobility because often mobility is considered to be at that of a specialty in orthopedic.
Hmm.
So
Yeah,
that
absolutely.
even mobility can be attained by neurological physical therapy exercises.
Oh, 100%. Yeah, that's pretty much the main part of my job is like just kind of take you through like a day to day of I'll walk in and into the clinic and I look at my schedule, and I kind of see, okay, it depending on the severity, I'm going to be working on trunk control for one session. I'll be working on bed mobility exercise for another session, teaching somebody how to roll again in bed. Obviously, a lot of gait training, walking training, whether it's more hands-on and facilitatory or a little bit more hands-off, kind of doing more of the movement specialist where I'm observing their walking and deciding like what areas I think need to be addressed in terms of, flexibility at the joint, strengthening. Is it a balance or a sensory impairment that's causing their gait to be off? And then sitting
Okay.
position in the wheelchair, postural control. I could keep going, but it's just yeah, it's a lot, and it's really good. Definitely, mobility is kind of the center of the of like the piece of pie in terms of like neuro PT of what I'm addressing.
This shows that how what a broader aspect this branch of physical therapy holds. Well, moving on to the segment, Dr. Trevor, where I have a lot of Instagram posts ready with me. You know, we have a lot of doctors on Instagram, that too without degree. And people often follow such Instagram pages who is a nameless, which we have nameless pages, nameless faces, and faceless pages, I would say, which claims to be doctor, and they just spread out so many posts about medical and medicine. So I have a few posts ready for you, and you need to tell me if this is a fact or a myth. So are we ready to go? Shall I start with this?
Sure.
Well, the first post says walking backwards exercise is harmful for our brain because it confuses our mind for the wrong side of walking.
Walking backwards is bad for the brain.
Yeah, the post says.
Okay. Yeah, that post should be removed. No, retro walking is extremely important depending on what their needs are. I mean, hip extension is like a vital movement for regaining gait pattern, like a normal gait pattern after a neurological injury. So I use a lot of backwards walking, retro walking. It's not going to confuse the brain at all. If anything,
Yeah.
it's actually going to help retrain the brain just as much as forward walking for in terms of like locomotion.
Yes. Okay. Another post says neuro neurophysiotherapy is only for the people who are mentally retarded or have problem within their brain cells.
I'm this is actually getting me a little flustered. I don't know where you found these. I'm glad that I haven't come across them. Ab absolutely not. No, I don't really have much more to say than they're flat out wrong. Yeah.
Okay, so the next post says band exercises result to be fruitful in foot drop cases.
Oh, okay. Yeah, there's some truth to that. I mean, what I tell people with foot drop is it truly depends on the severity of their foot drop, whether it's a full paralysis of the nerve that's affecting their ability to lift their foot, or if it's a partial paralysis. Banded exercise can definitely help. Actually utilize. I have a video on my page where I use like a banded strap technique to help improve flexion for the ankle, knee, and hip. So yeah, with mass repetition, but also it's not going to be the solution, right? It's going to be something that you use as an intervention in order to build up the appropriate strength to be able to walk without a band.
Absolutely. And the last post says, okay, so it is saying, yeah, if you are having problem in your sleep routine, try giving a help. Okay, try taking a help from neurological physiotherapy. If you're having a problem in your sleep routine, try taking help from a neurological physiotherapy.
Um, what I'll say about that is not anybody can just come in and see a neurological physical therapist. You really have to have something going on neurologically. And typically in a physical therapy area, I'm going to be dealing with more of the mobility aspect of things, like we mentioned earlier. But yes, there are techniques we can do to improve sleep. And I think everybody responds differently, you know? So, yes, if you exercise just in general, that helps decrease stress and can improve sleep. So there is truth in that, but that's not something just because you're having sleep problems isn't going to be a reason you go see a neurological therapist.
Well, bingo, you have told everything which is a fact and which is a myth about these Instagram posts. Well, moving on, Dr. Trevor, I would like to know the role of neurological physiotherapy in cerebral palsy cases. How do you guys actually have that initial approach towards such patients, and what is the mode of and way of treatment for these cases?
I'll kind of be a little bit more broad on this one. But what I'll say first is that when you do neurological therapy, it's a very collaborative approach, just like anything. But we have physical therapists, occupational therapists, speech therapists, neuropsych. We have fitness specialists that people can see after they're done with their therapy. It's truly a collaborative approach and a team effort. That being said, we have branches of people who have different specialties. So, for example, I treat all neurological diagnosis, but I have a specialty in treating limb loss and prosthetic training. So that's kind of what my area of expertise is. Where we also have pediatric therapists at our neurological pediatric therapists that typically handle most of our cerebral palsy cases. But I would say, as we mentioned earlier, it's very much a patient and family approach when you're dealing with something like that. So coming in, creating a plan, not just for cerebral palsy in general, but for any neurological case, creating a treatment plan and approach, some kind of goals, not just goals that we have therapeutically, but also the patient-centered goals, and kind of center your treatment ideas around that. I know I didn't touch too much on cerebral palsy in general, but I think in terms of neurological care, it's not very, you don't have to be super specific. You have to be very patient centered and decide like what is the most important to them, and then build your treatment plan based off of that.
Also, Dr. Trevor, I would like you to tell my audience how should they choose their neurological physical therapist? Like what attributes should they, look into it? Like I would say the questions they should ask him or her, whether he is actually the one they are looking for.
Yeah, I think just like any therapist, you have to be able to kind of, vibe with your therapist. You've got to have a good rapport. And like for me, like every day I walk into work, I'm having fun. A lot of these patients are in very vulnerable positions in their life, and sometimes they don't just need a shoulder to cry on, they need somebody to talk and laugh with them and help educate them, while treating them as if they're a family member. That's what I do. I treat every approach as if they're part of my family, and what I would do if my mom or my grandma was in this position, and how I would take care of them. So I think find somebody who's fun, obviously is enjoying what they're doing and isn't burnt out. As healthcare professionals, we often get burnt out. We have to really like see the bigger picture of why we're doing this. So pick somebody who truly is showing that they care about you and what your goals are, and that you're having fun doing it.
And what about the geriatric population? I believe as a neurological physical therapist, you would be having a lot of patients from the geriatric population. So, what kind of problems do they come with, and how do you treat them?
Yeah, so we do see a lot of like generalized balance problems that come with the geriatric population. So, kind of like I mentioned earlier, is again just having fun. Like they're in a vulnerable position. I think when they come to you, give them stuff that they've never tried before. I think the best thing about therapy is I need to do stuff in therapy that's considered skilled, right? So do something that you can't maybe do at your house, or you can't replicate at home. Something that's really challenging for you, that you have the presence of a skilled physical therapist. So with our geriatric population, get really creative with your balance problems, ask them what their hobbies are, incorporate their hobbies into the activities. And because again, going back to the principles of neuroplasticity, salience is one of the principles, which means like doing what's important to the patient. So if your patient likes fishing, have them stand on, an uneven surface while they're acting as if they're casting a line out into the water, and then add some resistance at the end of the line while they're pulling it back in. I think one of the best parts about my job is I have to be in all of us have to be really creative in our approach. So it's fun.
Yes, absolutely. Well, Dr. Trevor, I have a question ready for you, which is kind of an accumulated question from the aspiring doctors, the future set of physical therapists coming up on our way. They say, "Hello, Dr. Trevor, how are you? Greetings from India. We would like to know what exactly we need to learn to become a great neurological physical therapist, because we are having problems in understanding the brain and its physiology."
So in terms of like where they should start to learn more, that's a really good question. I think exposure is the best teacher. So like for me, whenever I started, I was lucky enough to where I had one of my rotations at a neurological center as a student, which actually happens to be where I'm working now. But I think having that one-on-one personal experience and being surrounded by other professionals who maybe are experts in certain areas, that helped me the most. But in terms of like learning, I think you just need to find the one I use PubMed as most for most of my research, and I usually go on there. And if there's something that I'm interested in, I just look up an article regarding that area of care and try to find obviously a, a reliable article, and just do a lot of reading. I read a lot of research to stay up to date on my care, and um, not that everything has to be completely research oriented to be effective, but I think that being up to date on your research is the best way to help promote recovery and pushing forward in the field of therapy.
Well, last but not the least, Dr. Trevor, as a physical therapist, as a doctor, what would be your biggest piece of advice for everyone listening and watching this episode right now?
I have two pieces of advice. I would say the first thing is don't be intimidated by a diagnosis. Just treat the human being that's in front of you like they're a family member. Have fun. That's another big one. No matter what you're doing, be engaging, make your session fun. And then another big one is I work in an outpatient facility where I only see people usually 2 or 3 times a week. And so I'm kind of more of their tour guide, right? So like when I'm giving them a home exercise program, I need it to be it's much more effective to have a small home exercise program of 4 to 5 really quality exercises rather than handing them a book of 20 exercises that they're going to be overwhelmed with because they already have so much going on in their life. So pick 4 to 5, sometimes more, really high quality exercise that you think would give them the biggest bang for their buck, and also go over that exercise regularly with them to make sure that they fully understand it.
Absolutely. Well, with this, we have come to an end of this episode, and I know that all the audience, all the people in my audience would have enjoyed it. And till now, they have got a broader view, broader aspect of neurological conditions and neurological physical therapy. Well, thank you so much, Dr. Trevor, for taking out time from your schedule to speak to my audience and me. I really hope you enjoyed it and you had a great time as much as we had listening to you.
Absolutely. Life's all about having fun. So I appreciate you bringing me on here. This was a good time. Thanks a lot for having me. It was awesome.
Thank you so much. Well, this is your reminder to straighten your back, have a glass of water, and move. Also, take care of your throat because you can see me suffering from it. So, please be cautious about it. We'll see you in the next episode. Till then, goodbye. Take care.